Disasters can include fire, flood, earthquake, hurricane, tornado or severe weather. Acts of terrorism may also be considered disasters. Know the appropriate action to take to protect yourself and your patient. The following guidelines apply to any disaster situation. Remain calm. Listen to the radio-television bulletins. A battery-powered radio will help you remain informed if power goes out. Locate disaster supplies. Ideally, a disaster supply kit should be assembled before disaster strikes. Emergency and disaster preparedness plan at a minimum. You should have the basic supplies listed below. Water, 1 gallon per person, per day. 3-day supply for evacuation, 2-week supply for home. Food, non-perishable, easy-to-prepare items. 3-day supply for evacuation, 2-week supply for home. Flashlight. Battery-powered or hand-crank radio. Extra batteries. First aid kit. Medications, 7-day supply and medical items. Multi-purpose tool. Sanitation and personal hygiene items. Copies of personal documents, medication list and pertinent medical information, proof of address, deed lease to home, passports, birth certificates, insurance policies. Cell phone with chargers. Family and emergency contact information. Extra cash. Emergency blanket. Maps of the area. No. Emergency Kardex. Emergency Kardex ensures the continuity of patient care and serves as a communication tool among healthcare providers. Emergency Kardex. Level 1, high priority. Patients in this priority level need uninterrupted services. The patient must have care. In case of a disaster or emergency, all possible effort must be made to see this patient. The patient's condition is highly unstable and deterioration or inpatient admission is highly probable if the patient is not seen. Some of the examples include patients requiring life-sustaining equipment or medications, patients needing highly skilled wound care, and unstable patients with no caregiver or informal support to provide care. Level 2, moderate priority. Services for patients at this priority level may be postponed with telephone contact. A caregiver can provide basic care until the emergency improves. The patient's condition is somewhat unstable and requires care that should be provided that day but could be postponed without harm to the patient. Level 3, low priority. Patients may be stable and have access to informal resources to help them. The patient can safely miss a scheduled visit with basic care provided safely by family or other informal support or by the patient personally. Advance directives are legal documents that allow people to decide what kind of medical care they wish to have in the event if they are unable to make those decisions themselves. Healthcare Proxy (HCP). It is a signed, dated and witnessed legal document prepared by attorneys that appoint someone else to make medical decisions for a person in the event he or she becomes unable to do so. It can include instructions about medical treatment that the person wants to avoid. This document references important information about care plan, medications and diagnoses. This document also states preferences regarding end-of-life care. Examples include as follows: mechanical ventilator breathing, tube feeding, IV hydration, antibiotics and kidney dialysis. Do not resuscitate. DNR order is a document signed by doctor that instructs 911 responders not to perform life-saving cardiopulmonary resuscitation (CPR) or other procedures to restart the person's heart or breathing if it stops.